So welcome to today's pre-webinar. So this is let me introduce myself. I'm Ebinesh. I'm currently working as a Prof. Kati fellow at All Day Children's Hospital in Liverpool. So in this next 30 or 40 minutes, I hope to take you through what after FRCR, what are the opportunities that we have in the UK, and what and how do you plan your career in the UK, and what pathways do we have? So in this, sorry, this is something. Yeah, I'll be happy with this. So in this webinar, I'll be going through what are the pathways. So how do you sequentially, what do you do after your FRCR exam? If you're planning to move to the UK, what all should you be doing? And what all you should be focusing on, or what all will be the subsequent steps that so that you can plan things well ahead in time. So immediately after your FRCR, you'll have to first apply for an English language exam, and then after that, with the English language exam, you'll have to apply for a GMC license, the General Medical Council license, and then you'll find a job. And then there are different career pathways that you can choose while finding a job. What job do you want to start with? And there are different workplaces or work setting setups in the UK that you can join. So it depends on your choice where do you want, and end with some practical tips that I learned when I moved to the UK. It's been almost 9 months that I moved to the UK. So yeah, in this presentation, it's going to be about the objectives of my webinar will be to understand what are the UK entry requirements, what are the different pathways available, and give some practical guidance on it. So immediately after, yeah, so I'll be starting with you finishing your FRCR 2B. So you're done with your 2B. You have got, so after your 2B examination, you will get a mail from the Royal Colleges saying, do you want, you're not going to get your degree certificate till the graduation. You can either get your degree certificate in person when you go to one of the convocations, or you can get it sent by post. But till then, you won't have your degree certificate. So, Royal College RCR will send you a mail asking, do you want a degree letter or do you want a verification letter? So, which will say that so and so, this is to certify that so and so has cleared the FRCR examination. So, you can get a letter before you. Because getting the actual degree certificate or the FRCR diploma might take a few months. So you can apply for a letter, and you can get the letter first, and then start your GMC registration process. So for your GMC registration process, it is mandatory, other than except that if you're except when you're when you have an English speaking country passport, a passport from the English speaking country, you will need English language exams. So the usual English language exams that people appear for is OET, because OET medicine is what usually people prefer, because everything, the scenarios and everything are specific for doctors. It is like your conversation speaking is the speaking component is something like a conversation between a doctor and a patient, or something like that. So it is quite stream specific. So that is what that is what usually many doctors prefer, because it is easy to prepare, and it is something, it mimics, and writing is something like writing a referral letter or for a GP to a specialist or something like that. So these are all specific per doctor. So this is what usually people prefer. And you need a grade of B. You need a B grade. This will need maybe 1 week of preparation, not more than that, but 1 week of on and off preparation should help you get through OET, getting a grade B in OET. IELTS, on the other hand, you will have to appear for IELTS. There are two types of IELTS. One is IELTS General and IELTS Academic. You will appear for IELTS Academic, and you'll need an overall score of 7.5 and a minimum of 7 in each of the domain, and the validity of this is 2 years. So, but many usually prefer OET, but you think your English proficiency is good and you can do it. The only difference is that I think IELTS costs you around 17,000 Indian rupees, and OET costs you around 35,000 Indian rupees. So that alone is the difference. But yeah, but getting 7.5 is quite challenging in IELTS. You'll really need at least 1 or 2 months of dedicated preparation for IELTS. Yeah, you can apply for OET as well. And yeah, next, after you get your English language exam, you will start your GMC registration process. So what you'll do is, when you apply for your English language exam, after you apply, you will have an option of sending your results directly to an organization. So in that, you will choose that you want to send it to General Medical Council UK, so that you don't have to send your results at all. You can directly send the results. Your results will directly go from the organizers of the OET to the General Medical Council, so you don't have to send your results. But yeah, GMC also wants that. GMC wants the results to be sent directly to the GMC, directly to the General Medical Council. So make sure that you choose to send your English language results directly to the General Medical Council. So yeah, then you'll start your General Medical Council registration. You have an English language exam. The result has been sent to the General Medical Council. After that, the most important thing you'll need is an EPIC verification. So you'll create a profile in EPIC, and you will apply for source verification of your primary medical qualification and your FRCR degree. So if you have your MD or DNB, you don't have to get that verified. It is just your MBBS degree and your FRCR degree that has to be verified, right? It is just your MBBS degree and your FRCR degree that have to be verified. So there is some people say that you don't have to get your FRCR degree verified. I also thought so. So I did not apply for a verification of my FRCR degree, but then GMC, I was asked later by. So this will cause undue delays in processing your application. So I had to wait for another 3-4 weeks for till my FRCR degree got verified. So I would say, at the outset, get your primary medical qualification and FRCR verified from EPIC. And then, so when you get your EPIC verification, you can now start your GMC registration process. So the prerequisites are English language exam results being sent to the General Medical Council, and the EPIC verification of your primary medical qualification and your FRCR degree. And then another important thing you will need is the good standing certificates from all the medical councils that you have worked in. So say, for example, I graduated I did my undergrad from Karnataka, then did my postgrad from Delhi, then worked in Tamil Nadu. So I had to get good standing certificates from all these medical councils. Yeah, so you will get a good standing certificate from all these medical councils, and these good standing certificates again have to be sent directly to the GMC, right? So the good standing certificates have to be sent directly to the GMC, right? So this can take up to a month. If you have everything in place, you can take almost 3 weeks. But if they require any additional documentation, it can get prolonged as well, right? So have all the documents ready. Another a mistake that people do is people choose portfolio pathway. Do not choose portfolio pathway. Portfolio pathway is towards your CSER that you'll work towards after you move to the UK. So don't choose portfolio pathway. Say that you have a recognized specialist qualification, and but then don't go to portfolio pathway. Portfolio pathway is not it is something later. It will need 1,500 pages of paperwork. It is not for don't start it to get a medical GMC registration now, right? So then yeah, so how do you find a job in the UK? Now you have your English language exam, you have your GMC. Now you'll have to find a job. So It depends on you. I would say it is better if you have your GMC registration and then start looking for jobs, but it can change. But say for example, I got three offers initially before moving to the UK, and all three offers were before I even took my English language exam. So it is totally up to you, and if you get shortlisted, it's good. If you but the chances given in the current scenario without a GMC registration, getting shortlisted for an interview is a bit unlikely in the current situation. So I would advise that you give your English language exam, get your GMC registration, and then apply for jobs. Right, and then apply for jobs. But anyway, you can, if you can always mention in the job application that you have applied for your English language exam, or you're appearing for your English language exam on so and so date, and your GMC registration is expected in so and so date. So you can mention that as well. So where do you find all the jobs? You can find all the jobs on the Track Jobs website. If you can just Google Track Jobs website, and you will find all the radiology jobs that are available. Choose which field you want. You stick to radiology or any all the recruitment in the UK happens through the Track Job portal. So yeah, so this is the main portal for NHS recruitment. So you can look for Track Jobs. Another website we have is the NHS Jobs. This is another official platform, but it often the application should be eventually made through Track Jobs. Right, the application should be eventually made through Track Jobs. So it's better if you stick to Track Jobs. Or some of the especially for fellowships, if you want to plan maybe 6 or 7 months in advance, sorry, if you want to plan 6 or 7 months in advance, you can visit the individual trust websites. Say for example, I was looking for a fellowship opportunity at Alderhay, Liverpool. So I was looking at the trust website. So you can always have a look at the trust website. So there they would have given you a timeline as to, okay, if the fellowship options they open between August to August. So when are the applications opening? So you can find that information on individual trust websites. By trust, I'm talking about hospitals. Hospitals are called trust, not really, but so there are in the organization in the UK is such that there are trusts in the UK, and each trust has different hospitals. Say for example, I worked at Lincoln before. So Lincoln was United Lincolnshire Teaching Hospitals Trust, and under the trust there were four hospitals. There was Lincoln County Hospital, Pilgrim Boston, there was Grantham and District, and there was another hospital, so Skegness. So there were four hospitals under a same trust. So they all come under trusts. So you can go through the trust websites or hospital websites and find out about the fellowship openings. And then you'll have recruitment agencies. There are a lot of recruitment agencies. So if you are on LinkedIn or something, people would have already come in. People would have already approached you. Are you interested in moving to the UK? And they do help you with that. So there are a lot of recruitment agencies like Doctors Relocate, uh, uh, Apollo does. So something like that. So there are a lot of Kaizen, or yeah, there are a lot of recruitment agencies which you can apply for. But one problem with, I mean, one not problem, one thing you want to clarify when you're going through a recruitment agency is look at what hospital it is, inquire about that hospital, see if it is very much in the periphery, look at what is the connectivity, because sometimes it can be an offbeat location which not many people are going towards, and that's why they are recruiting through recruiting agencies. So understand why, inquire about the hospital first when you're coming, when you're coming in, when you're getting an offer through a recruitment agency. Please first get to know the location, the locality, and the hospital first before making a commitment of joining the hospital or not. So yeah, how do you secure a job after FRCR? So first you'll make an application on the Track Jobs website, or through an agency, or however. So if you are making an application through the Track Jobs website, I would say that it is also better if you can send your if you can also mail your CV along with a small cover letter to. So usually all the job applications will have someone who will be will always have someone who will always have the contact of the clinical lead. So in India, we call them as head of the departments. Here we call them as clinical leads. So the mail address of the clinical lead will always be on a job advertisement. So you can send a mail across to the clinical lead saying that you are so and so, you have so much exposure. Tell them why you're interested in that job. Why do you think what do you think you can contribute to the hospital, and what support do you require from them. So send them a mail, attach your CV along with it to the clinical lead, and say that I have also made an application through the Track Jobs website, but I would like to express my interest directly in person. So sometimes when the clinical leads are very keen, they might ask you, they might schedule a virtual meeting. They might schedule a Teams meeting or a Zoom call with you and discuss about what the job is, what are the job responsibilities, what are you expected to do, what specialty are you supposed to have, and you can both discuss about your suitability for that particular job, right? So that is again possible. I would encourage people to do that, because sometimes after, say for example, I've got an offer after my fellowship, what I'm going to do. So when I was trying to choose a job after, to what to do after my a consultant pediatric radiologist job, I sent across my some letters to a few children's hospitals and had a discussion with them. So after discussing it with a few hospitals, I understood that those hospitals are not where I want to be, because it is not that those hospitals weren't good, but just that they don't align with their expectations, don't align with my interests. So I would encourage that you do that with the clinical lead before you're applying or before you're planning to relocate, right? So yeah, first you can send a mail like that, and some people do respond, especially all the academic hospitals, all the teaching hospitals with good academic centers, they do usually respond to your mail expressing interest. So then you make an application through the Track Jobs portal. After applying, then they choose a few applicants. So it is in the ratio, I am said that it is in the ratio of 1:3. For every one job post, three people are chosen for an interview. So out of all the applications that are submitted, they call few people for an interview. You get shortlisted for an interview, and then you make an interview, and the offer is made only after the interview. So how do you make a good call? So there are two parts to your application. First is making an application through the Track Jobs portal, and the next is performing in the interview. So first, I would say is in a very important thing is prepare a UK style CV. How do you know what a UK style CV is? It is available on the GMC website. It is available on the General Medical Council website. So go to the General Medical Council website, make your CV to match the UK style CV. Make it concise. It should be with headings. So focus on achievements, not just on duties, and it should be tailored to you. So by the time one person goes through your CV, they should have an idea about, okay, this person is interested in this subspecialty. So this is better fit for them. And one thing I would always say is start cultivating a subspecialty interest. So that is quite important in the UK, because you need some subspecialty interest. And in every application you will have something called supporting information section. So supporting information section is something that's very important. So it is not just, you can't just write randomly everything. So in this you will write, why are you applying for that specific post, what is your subspecialty interest, what evidence do you have to support it, and what all clinical skills can you do, what is your involvement in MDT teaching, have you done any audits or quality improvement projects, and how professional are you? You can quote some examples from your own life, and how do you align with the NHS values. Don't be very specific. Say, for example, if you're talking about fluoroscopy, say what types of fluoroscopic procedures can you do? Can you do fluoroscopy guided interventions? Can you do fluoroscopic diagnostic procedures like MCUGs, RGUs, barium study, GI studies, yeah, something like that. So be specific, linograms, whatever you can specify. If it's ultrasound, say what type of ultrasounds you do. Do you do just all routine diagnostic ultrasounds? Are they pediatric? Are they not pediatric? How many do you, what is your proficiency with emergency ultrasound? What is your proficiency with gynec ultrasounds? Because when I took a job, I said my experience with antenatal and gynec ultrasound. You don't have to specify about antenatal because radiologists don't handle the antenatal part of things. So you can say that I told that my experience with gynec ultrasounds is quite limited, and that is not what I'm interested in. So you can specify like that. So be concise. So demonstrate a trajectory. So you not don't just pick up some random achievements. So say for example, if you're interested in interventional radiology, say what did you do? So during my post graduation in MD radiology, I did so and so things to cultivate my interest in interventional radiology. Then after my graduation, I worked in so and so hospital where I did so much of interventional radiology. Then say that I progressed to a purely intervention job under the mentorship of so and so. So demonstrate a trajectory. So and show the panel what they have to, so who you are and what they need to know about you to make an offer. So that's something very important when you make an application. So before you're making a job application, read the description, look at the person specification. What is the department structure, what are the priorities, what services do they expect you to provide. So whenever you look for a job, so in the UK, when you're looking at the job description, see what are the expectations that the department has on you before you're applying, and then look at the job plan, what is called a job plan. So the job plan usually involves 8.5. Usually they must have 8.5 DCC. DCC is nothing but direct clinical care. Direct clinical care is nothing but reporting CTs, doing ultrasounds, doing fluoroscopies. So these all come under DCC. Then they should have 1.5 SPA. So SPA is supporting professional activity. That is the time you have for your self study. So that is the time. So every week, so by this I'm talking about all job plans in the UK are accounted for 10 PAs. 10 PAs are nothing but 10 programmed activities. Each PA accounts for 4 hours, right? Each PA accounts for 4 hours. So you'll have all the jobs are usually 10 PA jobs, 10 programmed activities. So 10 into 4 will be 40 hours in a week, right? So you'll have 10 PAs in a week. So that will be 10 into 4, 40 hours in a week. So you'll have a 40 working hour. You'll have to work 40 hours in the whole week, right? Of which 8.5 PAs, 8.5 programmed activities will be DCC, and 1.5 PAs will be SPS. So this should be the bare minimum. Some hospitals offer 8 and 2. So where you have 8 PAs of direct clinical care and 2 PAs as SPAs, supporting professional activity. These supporting professional activities for your self learning. You say that you sit and read, you read an article, you do research or something. You can it is up to you. It is up to you. So basically, if you get a job with 8 DCC, you're basically working for 32 hours in a week, and 8 hours is SPA, right? 8 hours you are spending it for your own learning and development. If it is 8.5, you are spending for 34 hours in a week towards work, and you are spending 6 hours in a week towards your self development, right? CPD points, attending sessions, attending webinars, teaching, or whatever it could be, right? So yeah, go through that on your job description. Now, another important thing is preparing for interviews. When it is interviews, try to be, you will have to work on your communication skills. That is very important that you work on your communication skills. They are not, I'm going, let me tell you that UK interviews are not going to be about your radiology knowledge. They're not going to test your radiology knowledge. Of course, they'll test the depth of your radiology understanding, but they are not going to directly, they are not going to ask you, they are not going to ask you what are the types of what are the types of medulloblastomas, or they're not going to ask you what is the staging of neuroblastoma. No, that is not what they are going to ask you. It is going to be, they're going to test your communication. They are going to test your ethical scenarios. I'll come to it in the next slide. So they are going to test how you fit to their team. So how is your thinking process? How do you, so something like that is what is going to be tested. You will have to work on your communication skills. That's the most important thing. So you have interview courses and resources. There are books available. There are courses available by Oxford Medical Learning offers a course. Anyway, I did not, I didn't happen to take any of these courses, but few people did recommend me a few courses. They are good. I know a few people who have taken a few courses and they find it useful. I haven't taken any course, so these are not my personal experiences. And some tertiary hospitals and quaternary centers do ask for a 10 to 15-minute PowerPoint presentation on a specific topic. So, say for example, if it's interventional radiology, so they might ask you, how do you challenges in providing 24/7 coverage, or interventional vascular intervention coverage in a tertiary hospital. What all do you think are the challenges? What do you think are the solutions? So something like that. So they'll be not on radiology topics. They'll be thought-based topics. Say, for example, what is your, how do you make a radiology department more green friendly? Make it more our carbon friendly radiology department, something like that, right? So it is going to be something, or making, reducing backlogs, or making, improving work efficiency, something like that is going to be the presentation, right? So most of the interview questions are going to be about ethical scenarios, ethical and professional scenarios. They will be usually on conflict resolution. Say, for example, you have a colleague who always reports, there is always a delay in reporting. What will you do? If there is a constant delay in reporting about your colleague, what will you do? Then if there is a difficult colleague, say for example a consultant, you have a consultant who publicly confronts you and contradicts whatever you say. So, or maybe you have a colleague who always criticizes you, who always ill treats his colleagues. What will you do? Dealing with stress, so you are overwhelmed with a lot of work burden. The AMR list is overflowing. You are doing acute MR reporting, and say you're in 4 hours you have to report 25 cases. How will you do? Then what are the patient safety issues, and how, if you make a mistake, if you have made a mistake in if you make a mistake, or if have you made a mistake in the past, and that significantly affected patient care, and how did you, what was your reaction to it? And in complex multidisciplinary situations, so say there is, you are in an MDT and there are two clinicians talking about two different things. They both are totally different pathologies. One is saying it's an infection, other is saying it's a tumor. How do you go about those situations? So these all will be ethical or professional scenarios, and the courses and resources are available to support you for with your preparation. Next, I think this is one of the important parts of the webinar today. Not many are aware of what can you do after your FRCR. So so you have done your MD, then you've done your FRCR from UK, or I would say you have done your radiology training, any form of radiology training in India, and then you have done your FRCR. What all options do you have? The first pathway is, you can, after you finish your training in the UK, you can start here as an ST3. You can start here as an ST3. ST3 is ST is nothing but ST is specialty trainee. So specialty trainee is a PGT, or a postgraduate PG, right? So you can start here. So here the radiology training in the UK is 5 years. So they do 3 years of general radiology and 2 years of subspecialization. So in the UK, you cannot, the concept of general radiology is it is not it doesn't, you usually have, they don't have a concept of general radiology where everyone practices everything. But though there might be hospitals where everyone practice everything, but then you should have some specialty interest, some subspecialty interest, because last 2 years they'll be spending only on that particular specialty. So you can directly enter, if you already have your FRCR, you can directly enter here as an ST3. So you'll spend 1 year as a general radiology resident and 2 years in whichever subspecialty interest you have, right? And then directly get what is called a CCT. CCT is Certificate of Completion of Training. You can directly get a certificate of completion of training. That's the first pathway. The second pathway is you start as a fellow, and after your fellowship, do a consultant job and then work towards your CSER. CSER is Certificate of Eligibility of Specialist Registration. The third pathway is you can start as a middle grade post or a locum consultant post, build your portfolio, and then apply for CSER. So if you directly get a CCT, you don't have to get a CSER because you have certificate of completion of training, which means you were trained in the UK. But if you start as a fellow or if you start as a locum consultant or a middle grade post, you will have to work towards your CSER. So CSER has its own challenges. So I'll go through it in a bit. So yeah, so the first pathway, as I told you, is enter as an ST3, complete UK training, and then finish CCT. So this is if you are a young radiologist, if you think that you'll need a little more of training, or you are happy to have another training in the UK. This is getting more popular nowadays among radiologists who are among overseas radiologists who are coming to the UK, because CSER has its own challenges. It needs a lot of evidences to be collected. You need almost, CSER is not an exam, so CSER is 1000 to 1500 pages of paperwork. So yeah, it has its own challenges. So in the recent times, there are a lot of people who've been who are looking for, who are currently choosing NST3 pathway, because they say that okay, you spend another 3 years in training, so that's okay. So you only for IR, I think you go up to NST6, you have an additional 1 year. So you just have 3 more years of training, and after that you don't have to worry about CSER at all. You directly get into the GMC specialist register, right? So you don't. So to get into a specialist register, you should either have a CCT or you should have a CSER, right? So if you directly have a CCT, you directly get, I mean, if you have a CCT, you directly get into the specialist register. You don't need a CSER. So you'll need you should have finished your FRCR 2B, and you should demonstrate that, you should submit evidences that you have significant radiology exposure. Yeah, radiology exposure in the past in your home country. And yeah, this is the most secure of all the pathways. I can tell you, this is the most secure of all the pathways. You will get opportunity to get trained again in a well structured manner. You'll get a consultant job easily, and you don't need CISA paperwork. But the entry is competitive, and it takes 3 years of training. That's the only pain in that. So the next is as a fellow, and then become a consultant, and then work towards your CISA. That is what I am hoping to work towards. So that is if you have significant general radiology experience, and you want a specific subspecialty experience. Say I want a pediatric radiology experience, so I'm doing my pediatric radiology fellowship. So it usually takes 1 to 2 years, and you can become a consultant after you become after you finish your fellowship. So yeah, so having a fellowship experience is really highly valid. It is considered an ST6 job, ST6 position, because the training here is 5 years. Sorry. Mhm. Yeah. So the training here is 5 years. So if you do after 5 years, you do one additional year of fellowship. So it's considered an ST6 position. So it is highly valued. CSER evidence, you need quite a lot of evidence, and you need a good departmental support, and you must maintain general radiology experience as well. Because for CSER, another thing for CSER is you should demonstrate competencies in all the specialties: breast imaging, nuclear imaging, CNS imaging, head and neck, thorax, cardiac, hepatobiliary, gastrointestinal, genitourinary, female genital, everything. You'll have to demonstrate your competency in all the, you'll have to demonstrate your work experience in all these subspecialties. So yeah, you can have good subspecialty training, but then you should have a broad general radiology exposure as well, right? So then another pathway is, which again, this is what I intended to do first when I left India. So that's why I started as a consultant. I started in the UK as a consultant and thought I'll apply for a CSER, but then I stepped down. I'm doing my fellowship now, to to get some subspecialty exposure in pediatric radiology. So yeah, so this is, you want directly to enter the UK and start earning well. So what all grades that are available are, you have trust grade posts, which are middle grade. You have specialty doctor, specialist grade. So these three are considered middle grade posts, and you can all become, or you can become a locum consultant. What does a locum consultant mean? Is locum consultant is the same as a locum consultant is the same as a sorry, yeah. So locum consultant is the same as a substantive consultant. The only they get, the pay is same. Everything is almost the same. The only difference between a locum consultant and a substantive consultant is that a locum consultant, you'll have to keep renewing your contract. So it is a contractual. It is based on a contract, so you will have either a 1 or 2 years contract, so you will have to keep renewing your contract with the hospital if you're a locum consultant. But if you're a substantive consultant, if you're in a substantive post, you don't have to keep renewing. It is a fixed, it is a substantive post, so you don't have to renew your contract at all. It is a lifelong post, right? So that's the only difference, but you get paid the same, everything else is the same, right? So but the problem here is, all the learning will be self-directed learning, and you have to proactively gather all the evidences for your CSER. So that is the only disadvantage. So if you want a structured training program, get into an ST3 path and into CCT. If you are already confident, you just want some subspecialty exposure, you want some good subspecialty exposure, UK trained subspecialty exposure, do a fellowship, become a consultant, work towards CSER. Or if you're already set, if you think that you already have what you need, you already have your subspecialty interest, you are very confident with whatever you know, start as a middle grade or a locum consultant, work towards your CSER. After your CSER, get you can get a substantive post, right? After your CSER, you show that you have done your CSER, and then you can get a substantive post as a substantive consultant. So whenever you're starting a job, if you're not going through the CCT pathway, whenever you're going to the other pathways, in your interview, always ask what support is your trust ready to give you support towards your CSER? Is your trust ready to give you a CSER support? If they're not ready to see you, that is a red flag. If they're not ready to give you CSER support, so are they ready to support with your appraisals, with having a supervising consultant, and do they have all the quality improvement audit MDT opportunities? Are they ready to give you that? You have to be really you will have to ask them about the CSA support that they are ready to offer when you take up a job. So now, yeah, so those are the pathways. Start as an ST3, go through training, finish CCT, or start as a fellow, or in any of the locum consultant or a middle grade post, and then work towards your CSER, right? So what are the different workplaces that you can choose? So you can either choose a district general hospital, a teaching hospital, or a specialist center. I'll tell you about these. So district general hospitals are usually in the peripheral towns, small hospitals. They are district headquarters hospitals, and they are usually mostly general radiology services with subspecialty clinics. So you should have general radiology experience, and along with that, you should have one or two, some small DGHs they expect you to have, because they can't afford to have only a person who's just doing one specialty. So you will have to do some general radiology. District general hospitals usually, say for example, the jobs will be like general radiology post with special interest in interventional radiology. So maybe out of 40 hours, you'll be spending maybe 20 hours on maybe 20 or 24 hours on general radiology, and maybe 2 PAs or 3 PAs or 4 PAs on interventional radiology. So yeah, that is how it will be. So you'll have to do some diagnostic reporting and do some interventional radiology, or it can be something like general radiologist with special interest in pediatric radiology. So you, out of 10 PAs, you will maybe do or you'll maybe out of 8.5 DCC, you'll maybe do 5 general radiology PAs, and you'll do 2.5 pediatric radiology PAs, something like that. Or some small DGHS will also expect you to have two subspecialty interests, say pediatrics and thoracic, say intervention and vascular, something like that. They might expect you to have two subspecialty interests because they can't afford to have a person who's doing only that particular specialty. So but if you are looking for a good work life balance, this is the excellent work life balance they'll give you. It is a very laid back life. You might not have any on call, uh you might not have any on call commitments. They usually district general hospitals outsource their and they send it to the Nighthawk services. All the scans in the night are sent to the Nighthawk services. You might have very reduced rota intensity. It is a low stress environment. You'll have a very good work life balance. You'll have a quieter countryside lifestyle. You'll have a desi lifestyle. And if you have younger families, you want and you want to spend a lot of time with your family, no, a very predictable lifestyle, you can go for a district general hospital. But what are the disadvantages is that this is not for people who are highly ambitious, or want a very intellectually stimulating environment, or want to excel in one particular specialty. You can't sit in a DGH and say that, okay, I'll do advanced neuroimaging here, I'll do an APT sequence, I'll do perfusion, I'll do this, I'll do that. No, that cannot happen in a DGH. It is a mixed bag thing, and you won't have a lot of subspecialty advancement there. And the academic and research, if you're interested in academics and research, again, the chances will be limited for that. It is for someone who wants a good work life balance. You want general radiology, and you are happy with quieter environments, not very happening, but quieter environments. Yeah, and the other are teaching hospitals. Teaching hospitals are university hospitals. Say, I'm at Liverpool. At Liverpool, we have a university hospital, Liverpool University Teaching Hospitals Foundation Trust, which has the Royal Liverpool Hospital, the Aintree Hospital, and the Broad Green Hospital. So you can have teaching hospitals, which are tertiary care centers. They are in major cities, and they usually handle high volumes, and they provide tertiary care. And it is in teaching hospitals, it usually mandatory that you have a subspecialty interest. It is usually mandatory that you have a subspecialty interest. So it is in teaching hospitals, it is like, so you will handle only subspecialty reporting, but then when it comes to your on call, you will do general radiology reporting. Right. So you'll do, say, for example, if I join a teaching hospital, I'll do only pediatric radiology reporting. But when I'm on call, I'll have to do adult and pediatric radiology. All the urgent cases, I'll have to report both adult and pediatric reporting. Right. That is how the teaching hospitals function. So you'll have a very good case mix, trauma, oncology, specialist referrals. You can develop your subspecialty interest. You will be involved. You will have registrars. You will have fellows under you. You will have good career progression, but it is a bit busier than district general hospitals. You have a good degree of intellectual stimulation again, but the disadvantages are that you will have on-call commitments. You might have to stay on call, though you might have a registrar or a fellow who will be taking care of it. But if they have, you will have to be ready to handle if they are not able to handle, and you have a higher workload intensity. The environment can be quite competitive, and these since these are in major cities, the cost of living can be quite higher. And this is for someone who is looking for a career progression and subspecialization, and for individuals who want to thrive in dynamic and teaching environments or teaching hospitals. And the last set of hospitals are the specialist centers. Specialist centers are the quaternary cancer centers. So they are like, so whenever a patient in the UK gets sick, whenever anyone gets sick in the UK, they first go to GPs, general practitioners, and general practitioners refer them to the district general hospitals. And if the district general hospitals cannot handle them, they usually refer them to the teaching hospitals. If the teaching hospitals are not able to handle, they go to the quaternary care centers, right? They go to the quaternary care centers. Quaternary care centers are subspecialty specific. Say, for example, we have the hospital that I'm working is one of the quaternary care centers for pediatrics. It's all the H Children's Hospital. We treat only pediatrics. And there is Royal Orthopedic Hospital in Birmingham that take up only the orthopedic cases. And there is and there are there are cardiac hospitals, right? There is Liverpool Heart and Chest, which is only for cardiac and thoracic, so something like that. So these are all subspecialty hospitals which take up only those cases. So there are GI specific hospitals, which do only digestive diseases, so something like that. They are regional and supra regional centers. They handle rare and highly complex cases. You will need hyper specialization here. You will need quite it is not enough it is not just enough if you have if you have subspecialty. You'll have to be hyper specialized. Say, for example, if it is pediatric, I'm sorry, I'm referring to a lot of pediatric because that is my area of interest. So in all the hay, general radiology work is very minimal, but most of what work happens is all hyper specialized work. So there is a pediatric cardiac radiology team, pediatric neuro radiology team, and there is a pediatric neuro onco radiology team as well. And there is pediatric onco radiology team, pediatric MSK radiology team, so something like that, right? So you will have to be hyper specialized if you are in the if you are in the specialist or quaternary centers. They are highly intellectually stimulating centers. Good MDT involvement, like we have an MDT every day. We have at least 2 3 MDTs every day. And you will be in the policy making role. You will be in the policy or guidelines making role. You will be you will be in the top. You will be known to most of the people in your niche of interest. The work life balance is decent, but workload will be quite intense. It may require a long dedicated training. Case volumes can be high and demanding. You will have less or no general radiology exposure. Say, for example, I don't report any adult stuff now. The hiring is quite competitive. You will be expected to do a lot of research audits and academic involvement. This is for someone who is expecting very deep subspecialty interest in research. But a disadvantage is if you're working towards your CSER, this will be a problem if you're working towards CSER, because for your CSER you will have to demonstrate your competencies in all the subspecialties. If you are in a subspecialty specific hospital, this will be working towards your CSER will be a challenge. You might have to have a tie up with another general hospital where you get your get some general radiology stuff and then build your CSER application. So that is, so be cautious. So it might sound fancy, but there is a caveat. There is a catch in this. If you're working towards your CSER, then you will if you're joining a quaternary care center, please ask your team if they are ready to support you for your CSER, if they are ready to support you with your CSER application, and what form of support are they ready to send you one day to a general hospital to work there to get till you get your CSER, to gather evidences from that general hospital. So DGHS, you have an excellent work-life balance. Subspecialty exposure will be limited. Low to moderate intellectual challenge. Low on-call commitments. Career progression is moderate. Teaching hospitals, good and strong subspecialty interest, highly intellectually stimulating, moderate to high on-call commitments, and career progression will be high. Specialist centers, the on-call commitment changes, depends on specialty centers to specialty centers. Neuro centers, you might have, if it's intervention, you will have a high on-call, but you'll be paid more. Of course, if you have more on-calls, you'll be paid more. And they'll be very intellectually challenging. Cases will be you'll have the cream of cases because all the simple cases get filtered out. And you'll have a you'll have a good lifestyle here as well, but just that it'll be quite busy when you work. So when you're planning for now coming to the practical tips, so you'll have to build a clear specialty interest. So have this in mind. I really wish someone would have told me all this when I started planning my career in the UK, that you have so and so options and you can plan, you'll have to cultivate your mind in such a way that you'll have to plan it in your mind in such a way that you fit into any of these. Because when maybe if a highly ambitious person goes to a district general hospital, they might be really disappointed. But whereas maybe even if you are extremely good, but you want a if you want a if you want an extremely good work life balance, but you go to a specialist center just because it is your specialty, you won't feel good about it, right? So please make up your mind about where do you want to work. Is it in a DGH, is it in a teaching hospital, or is it in a quaternary care center? If it is in a DGH, build one or two broad subspecialty interests: chest and abdomen, MSK and neuro, something like that. So you'll need to be flexible and adaptable. If you're aiming for teaching hospitals, develop solid grounding in one core subspecialty, but you should be able to do some, you should be able to have you should be able to be in touch with some general radiology things and demonstrate a good academic involvement. You should have submitted posters, quality improvement project. You can take some short courses. If you're interested in MSK, do some MSK short courses, ankle course, something like that, by the Europe Institute of Radiology, by the Royal College of Radiologists, by whatever subspecialty societies. If you're aiming for a quaternary care center, you will have to show that, oh sorry, so you will have to show that you are hyper specialized, you are interested in some niche thing, some particular niche. So if you're interested in pediatric cardiac, you'll have to show that you do have a pediatric radiology exposure, adequate pediatric radiology exposure, and what have you done towards pediatric cardiology? What level of competence have you taken certified courses? So something like that. And you will always need a subspecialty fellowship if you need a quaternary care center job. So build a strong professional portfolio, whichever pathway you go through, be it fellowship, consultant, or ST3 pathway, whatever pathway you go through, you will need a strong professional portfolio. Please do researches, please do publications, audits, quality improvement projects, conference presentations, and cultivate some specialty specific skills. Be involved in teaching and get involved in teaching and make them official teaching involvement. Like what do I mean by an official teaching involvement is you should have a rota that someone has signed, maybe your head of the department has signed, maybe a supervisor has signed, that on a rota that so and so date so and so person is teaching so and so topic. And you should have your PowerPoint slides, you should be able to submit your PowerPoint slides, and you should gather feedback. So there is a specific format to get feedback, teaching feedback forms. So please check the GMC website. If there are 10 students, how many ever, 40, 50? So try to get feedback forms filled. So that makes it an official teaching session, right? You should have a schedule, you should have a rota that has been signed by your clinical lead or a supervisor or the head of the department or your dean or someone. And you should have PowerPoint presentations, or you should have your preparation material to support your presentation, and you should have feedback from the attendees. So these three components make it an official teaching. So if you are, please cultivate a habit of making these all. People, no one says these. I really think, I really wish people told me all this before I started here. Because see, the reason that our CSER applications get delayed is because we don't have adequate evidences. Though we have done everything, we don't have adequate evidences, we don't have evidences to support it, or we don't have complete evidences to support it. We have all done teaching, we have all presented seminars in your during your postgraduate time, during as a PG. But then you don't have enough evidences to support that you have done it, right? So try to make them official if you're planning to come to the UK, right? And if you're doing any intervention, if you're doing any intervention, get what is called, so have the intervention notes. Even be it a plural tab, be it a biopsy you're doing, any intervention, first get a first get the procedure notes, right, which should be signed by you and the consultant whom you did it under, or the supervisor or the professor who you did it under, or the SR who you did it under. They both should have signed with their medical council registration number. And the second is get what is called a DOPS, right? So this is direct observation of procedural skills. So you would have done your procedure under someone as a PG. So the DOBS the DOBS format is available on the GMC website again. So get a DOBS signed from whoever you're doing it, and if you're doing it under an SR, make an SR fill a DOBS form for you and store it with you. Yeah. So I really wish someone told me this, and I would have started collecting as a PG. You can start collecting as a PG and you can get a CSER immediately after you're done with it, right? So start collecting these evidences and making it official, and align your CV with your passion. Just your CV should tell a clear story of your professional trajectory. So what all, if you are applying for a pediatric radiology fellowship, you have had high peds rad rotations, you have been involved in pediatric cases, you have a pediatric MDT. If it's MSK, you have MSK courses, you have sports imaging exposure, you have done quality improvement projects or researches related to MSK, right? So that by within 10 seconds they should be able to guess that okay, this is your trajectory. And for everyone in India, whenever you're applying for a GMC registration, please don't do this mistake of, so if you're doing if you're, say for example, I did my undergrad from Karnataka, did my postgrad from Delhi, practiced in Tamil Nadu, and then for a few months I was also at PJ Chandigarh. So I was also in Chandigarh. So I switched like four different states in a few years time. So I had, but one mistake I did was I did not transfer my registration to all these medical councils. But whenever you're planning to move to a new medical council, right, whenever you're planning to move to a new state, first transfer your registration, then get employed, then show you that, say for example, you are moving on the 2nd of January. Say for example, you are starting a new job, you're doing your post graduation maybe in Chandigarh, and you are starting a new job in maybe Maharashtra on the 2nd of January. So if you are moving on the 2nd of January, you should have your registration before that. If you without your registration, don't start a new job. So if say for example you get your registration only on the 5th of January, start your job from the 6th of January. So even if it is 1 day of lapse, even if it is 1 day of not having a registration, they will ask you for an employer reference, and this employer reference should be from an official mail ID, and it should be directly sent to the General Medical Council, right? So it should be directly sent to the General Medical Council from an official mail ID. So it can delay your GMC registration process, and it can prolong your application. So don't do that. It is quite painful as well. It can be stressful, it can be painful. Sometimes they even ask they even choose to ask so if you say that you'll need a reference from, why did they'll ask, okay, this person only had a Punjab Medical Council registration. Why did you allow them to practice in Maharashtra? The employer has to answer that question. If they're not satisfied, they'll directly write a mail to the Maharashtra Medical Council asking, so and so person had Punjab Medical Council registration, but they were allowed to practice in Maharashtra, and so doctor from so and so hospital says that it is still acceptable. Do you agree with that? So they might do that. So please don't fall into this. Whenever before you are migrating to another state, first transfer your registration to that state council and then move, because they are even if it is 1 day, they are definitely going to ask you for an employer reference, right? Even if it's 1 day delay, they are going to ask for your employer reference. Then actively participate in MDTs or tumor boards. So build a good clinical rapport. You will need feedback forms from your clinicians that you can collect from the UK. Shouldn't be a problem. You will need evidence for your CSER that you have participated in MDTs. Make MDT logs. Keep MDT logs. What all cases did you present in the MDT? What did you discuss? What was the final outcome of the MDT? And obtain clinician feedback. You will have to provide evidence for your CSER right? So you get involved in more MDTs. I really wish someone would have told me all this before I started, right? So then is one thing that people don't look about is, okay, come to UK, come to UK, come to UK, but what after coming to UK? Are you working towards your CSER, or is it for your CCT? If you are saying that it is for your CSER, go through the specialty specific guidance, right? Go through the specialty specific guidance. The GMC specialty specific guidance is freely available on the GMC website. Have a take a I always have a printout. I didn't, no one told me this, but I did this after coming here. So I got it printed. I always read through this. I always see every day or every week at least I go through it. What evidence do I need to collect? Because it is again 1,200 to 1,500 pages of evidence that you have to support, that you have to submit, right? So you will have to prove your evidences for all this: general radiology reporting, specialty reporting, emergency imaging procedures, MDT, teaching, audit and quality improvement, appraisals, leadership and governance. What form of leadership? So if say for example you have some leadership skills, get a proof for that. If you were involved in organizing a conference, or a workshop, whoever was the convener, whoever was the organizing secretary or the organizing president, get a letter from them that you worked in organizing this, and what was, don't just get that, that's very non-specific. And they have to specify what was your role in this. You were, say for example, you were involved as a hall coordinator, you were involved in, you were involved in getting in touch with the speakers, collecting their presentations, organizing things, getting streamlining the sessions in a hall, something like that. So it has to be specific, right? So if you're involved in any of the leadership or the governance things, right, so get a letter from whoever you did this as a proof for whatever you have done. And research and CPD again is important. You will need proof that you have proof of publications, presentations, and what all CPD points. CPD is nothing but CMEs you have attended and something like, and all CMEs, and have a habit of maintaining something called a CPD diary. So what will you do is, you will write, okay, this day, this date, I attended this CME. So you make a table, date, what is a CME, how much is the CME hours, or how much is the C credit hours, how many points are you getting, credit points are you getting, and write a reflection, write 2 or 3 lines reflection. What did you learn from it? Right, what did you learn from it? Start doing it from now, right? Start doing it from now, because again, this is something that you'll have to submit for your CISA, right? What is the date? What is the CMU attended? uh, how many credit hours did that give you, or how many points did that give you? And what did you learn from it? What is your reflection on it? Write all this, start documenting things in this format, right? Because you'll have to provide this evidence, right? So, and start building professional relationships, seek mentors who can support you with your UK application, or your career in the UK. Attend conferences, ideally UK conferences. Network with consultants in your subspecialty. Join communities, online communities and journal clubs that go online. So your networks will open along, your open doors long before your CV does. So yeah, so it's really important that you do some networking with all your colleagues. Yeah. So that is all I have to say. I can take up some questions, be it about life in the UK, or be it about you have any particular question that you want to ask, any specifics that you want to know about. Please feel to unmute yourself and speak, or maybe you can or maybe you can put in the chat box. I'll be happy to answer your questions if there are any. Any questions? How is the life as a radiologist in the UK when compared to India? Okay, I would say there are few advantages. I would say it's better than in India because it is not whenever maybe in one if you are in a government hospital, if you are in a government hospital, it's a different thing. But if you are going to a private hospital, quantity is more than quality. They want you to churn out reports. They want you to churn out reports 1 hour, half an hour. So they have all targets. I've worked in corporate hospitals which have JCI, Joint Commission International Certification. They are all very time critical. An emergency report should be signed off within 1 hour, however complex it is. And and then if it is an out if it's an inpatient report should be signed off within 4 hours. If it's a outpatient report, signed off within 6 hours. So and you should be having a minimum target. So if it is one if you're doing ultrasounds 4 hours, you'll have to do 40 scans. So they are all quantity based, not quality based, and you will be quite exhausted you will be very much exhausted to have a lifestyle like that. And if you want to make a lot of money, if you want to make a lot of money that you're making, the amount, if you want to make a similar amount of money that you're making in the UK, you will have to run between hospitals and you'll have to have an exhausting lifestyle. But here you can have a good work life balance. Say for example, I was online I was I was online if I was online in the I mean sorry, I was on call for this weekend. So I have if I'm on call as in you have a system in at home. You have to report things from home only if it is ultrasound or fluoroscopy and an emergency upper GI series or something. I'll have to go and do it. So only in that case I have to only in that case I'll have to only in that case I'll have to go to hospital. Otherwise I can sit at home and report everything. But I get an off on Thursday, so and on Monday, right? So you have a very good work life. And if your work time my work timing is between 9 to 5 p.m. and I work only between 9 to 5 p.m. Beyond that, no one is going to bother you at all. No one is going to bother you. And one more thing, it's very professionally satisfying. Very professionally satisfying. The patients, so it is like you eventually get follow up into everything. You feel that you are important. You when you are in an MDT setup especially, you feel that you are important. You are doing something towards the patient care. So I think it's more professionally satisfying, more quality based. And we don't write stories here, pages of reports. We make our reports as crisp as possible, but with as clinical information as required, as much as required. And you have your protected study time. Say for example, even in those 40 hours that you work, you still have 8 hours. You just imagine you work 40 hours in a week, and in those 40 hours, and that is only 5 days. I'm telling you, in the UK, work is only 5 days a week and 2 days are off. You don't work on Saturdays and Sundays. You work only 5 days a week, right? And some hospitals work on only 4 days a week. But then you will have to work. So if you are working between 8 to 6 p.m., 8 p.m. to 6 8 a.m. to 6 p.m. in a day, you work for only 4 days a week. If you're working between 9 to 5, you work for 5 days a week, right? So and of those 40 hours you are going to be work, you have at least 6 to 8 hours that you can spend on your own, that you can sit and read or do anything, or you just simply sit, or you do anything, but you have to say that you have done something. And yeah, you with just you can. And yeah, so it is, you have a protected time for your own development. You have a good work life balance. It's professionally satisfying. And the modalities, I love the clinical cases that I get here. They're extremely rare. The creamy cases, very rare cases. Say for example, yesterday we had a case of ADGRG1 mutation spectrum. So you get you all these cases get fully worked up, right? All these cases get fully worked up in a very short span. So yeah, that's something I love. So it is good. Yeah, then, oh, thank you. And firstly, excellent presentation. Is GMC registration a must to apply for? Absolutely. In the sense, you will have to, if you want to practice in the UK, you will need a GMC registration, but it is not mandatory that to make an application, because I applied for my fellowship without a GMC registration, right? I applied for a Yeah, I did make my application before GMC registration. I got 3 job offers. Uh, without a GMC, without even I got my offers and then started apply and then applied for the English language exam and then started my GMC registration process. But in the current view of things, I would say it is better if you have your GMC registration and then start your application, because it is like uh, your application should be shortlisted for an interview. So sometimes it's possible that you might not they'll want someone to join as early as possible, so they might filter out all the people who do not have GMC registration. So in that case you might not, so you'll need need an interview to exhibit your talent, isn't it? So to yeah to get a chance, to get an opportunity for that, I think it's better if you have a GMC registration. But anyway, it is worth giving a try. I just thought that it is worth giving a try. You can apply for a, you can say that your GMC registration is under process or something, and you can make an application and see how it goes. I have worked predominantly in corporate hospitals and diagnostic centers post my MD. Will I be still eligible for? Absolutely, yes, you are still eligible. If you can, if you at teaching hospitals, then you should be able to demonstrate that you have some specialty interest, because the teaching hospitals are all like they all prefer. They all prefer people with subspecialty experience. So it depends on, or maybe you do a fellowship here and then have that subspecialty and then move to a teaching hospital. That's again possible. Yeah, but you should have some subspecialty interest before. Maybe you're good at something, or maybe you say that you demonstrate that you 60% of your work is general, but 40% is MSK, 40% is neuro, something like that. If you can demonstrate, yes, you still stand a chance to go to the teaching hospitals, because teaching hospitals, I think it's mandatory. They usually ask for some have ask for dedicated fellowships. Many hospitals, say Oxford, Alderhay, Nottingham, many of these hospitals, Cambridge, they all want some subspecialty fellowships as well. They want a fellowship training. But there are other teaching hospitals, yes, they'll be happy to take you, but you'll have to show that you're inclined towards one specialty. How is the pay during fellowship? The pay during fellowship is not very different from a consultant. I have received a consultant's pay and now I'm receiving a fellow's pay. I think the pay difference, I think as a consultant without any on calls, apart from every tag, apart from the tax and everything, without any night duties. When I was a consultant, I didn't do any night duties. By night duties, I mean I did no night duties. I worked only one in 18 weekends. So 1 in 18 weekends. That too, I worked between only 9 to 3, 9 to 3 on Saturday and Sunday, 1 in 18 weekends. So with that, you get around 7 lakhs, 6.5 to 7 lakhs. And during your fellowship, you get around 5.5. That is very much enough to maintain a family, actually. And can we enter CCT post 2A? No, you need you should have finished your 2B for a CCT. What is the pay scale for an ST3 and a fellowship? Yeah, for a fellowship, I already told you. For a fellowship, for an ST3, it is, I think, around 60,000 pounds per year. And for a fellowship post, I think it's around 75,000 or 70 or 75,000 pounds. So I think it's 60 to 65 ST3, 70, but you will make a good decent amount. As an ST3, I know ST3s who are making, ST3s make around, I have 5 registrars under me. ST3s make around, I think, 4.5 lakhs. 4.5 lakhs at least. Yeah, that's a decent amount, and you'll have a good work-life balance. If you're doing night duties, again, I'm saying all this is excluding your night duties. If you, the more night duties you do, the more locum duties you do. Say, for example, the department is in a crunch and they want you to work more. If you are ready to take up those works, then you'll be paid more. Yeah, and the locum pays are quite high. Revalidation after GMC. Revalidation after GMC, I think, is after 5 years of your GMC. Once you're done with your GMC, you get into an NHS. Then you get something called a revalidation. So that depends on your appraisal. So you get every 1 year, you get something called an appraisal. They evaluate your performance. How have you, so that depends on a lot of things. Have you done research? How were you? Was there any delay on your side? Did anyone raise an incident against you? Did anyone give you a good incident report? Did anyone say that you are really good? Did you will have to get feedback from your colleagues, from your receptionist, from your secretary, from patients, from everything, and they'll collect 5 years of your appraisals. And then you have someone called a responsible officer who will send a recommendation to the General Medical Council saying that this person has demonstrated adequate competencies, has worked adequately, and it is clinically safe to practice. So please extend his registration for another 5 years. So that is called revalidation. Then once the GMC receives a revalidation report, you get your extension for another 5 years. But you have a yearly appraisal. You have one appraisal every year, and where you will have to, so by the beginning of the year, say for example, I had an appraisal at the beginning of my fellowship where I had to tell what all am I looking for during my fellowship. So in professional aspect, in academic aspect, in scientific aspect. Professional, say for example, what all competencies. If it's cardiac, okay, I should have reported at least 25 cardiac scans, at least 20 cardiac MRs. If it's MSK, I should have reported at least 10 non-accidental injury or suspected physical abuse skeletal surveys. I should have done so much, so much. So like that, you'll have your objectives defined, and then by the end of the year, they'll see if you have met all your objectives. They call as PDPs here, personal development plans. If you have done all your personal development plans, right? So you have appraisal. So that is after 5 years of appraisals, you'll have a revalidation from the GMC. Can we apply for it is better, okay, if you don't have a subspecialty experience in India but you're inclined to some subspecialty, you will have to prove what you have done towards that subspecialty. Say for example, if you don't have, say for example, your this is your subspecialty interest is pediatric radiology, because that, I'm sorry, I'm sticking to that again and again. If that is your subspecialty interest, you will say that during my residency, I did so much of reporting in pediatric radiology. I did my work was so much into pediatrics. I had so much experience in this. My thesis was on pediatric radiology, or I have done so much of research in pediatrics. I have attended so many pediatric radiology conferences. I have done so many pediatric radiology related courses. Short term courses or something like that, or workshops. I have attended so many workshops. Say, for example, AOCR conducted in Chennai last year had sessions on fetal MR and pediatric neuroradiology. So you say that I attended workshops for that. So you incline your CV towards one. You will have to somehow incline your CV towards your subspecialty interest or towards a fellowship that you're applying for. Will 3 years general SRship in AIMS New Delhi help with CV, or is it better to do 2 years of fellowship and 1 year of fellowship? See, it depends on it. I don't know. It depends on if you will you be if you're working towards your CSIR. I think it is. I think you should be working in a place where you can collect your evidences. So if you work 3 years as an SR in some hospital, you should be able to say within these 3 years, you should be able to give them all the stats. You did so many ultrasounds, you did so many of these ultrasounds, how many were abdomen, how many were gynec, how many were pediatric, how many were MSK, how many were head and neck. So you'll have to give a split up. If you reported so many CTs, okay, I reported so many CTs, how many were CT heads, how many were trauma CTs, how many were abdomen CTs, how many were liver CTs, liver scans, how many were onco scans, how many were chest scans, how many were, so something like that. You'll have to give a split up of all this. So I think if you again, it depends on where do you imagine yourself to yourself to be. If you are imagining yourself to be in a tertiary or a quaternary care hospital, I would say maybe I don't know if you need an SRship. I did not do an SRship. I'll be honest with you. I did not do an SRship. After my PG, I directly went to a corporate hospital, worked there for 1 year, and then came to the and then did stayed in did a short term training in PGI for some time, and then came directly to the UK. So yeah, so it is. I didn't want to do an SRship, so I don't know. Maybe any experience is fine. I'm not sure if you. I don't think you specifically need an SRship experience, if that makes sense. And if you are planning for a quaternary care center or a tertiary care hospital, I would say maybe 2 years of SRship and a fellowship will be of a better choice, will be better than doing 3 years general radiology. How do we know? How do we show subspecialty interest while we are preparing? That's what show publications, so that show researches, show that you are involved in forums. So say if you are involved in if you are neuroradiology, so that you are a member of the Indian Society of Neuroradiology, and what all have you contributed, how many conferences have you attended in neuroradiology, how many courses have you taken in neuroradiology, how many seminars have you taken in neuroradiology, how much reporting have you done in neuroradiology, and how much publications and how many researches you have done in neuroradiology, something like that. Yeah, a bit of off topic, but if the final goal is to work in UAE, is there significant difference in pay, FRCR with Absolutely. See, with so there are three. When you're working in the Middle East, when you're working in the Middle East, they grade you into three tiers: tier one, tier two, tier three. Tier three is Indians with just FRCR. Tier 2 is no, I think no. Tier 1 is India without any experience. Tier 2 is uh, PG with some experience. PG with some experience. So then yeah, then tier 2 is with you have some experience. So even with with FRCR and Indian experience, you'll be still considered tier 2. If you need tier 3, you will need a CSER. You will need CSER. You should have worked in the UK for at least 3 to 5 years, and you should have CSER. Then you will be tier 3. Tier 3, you get a consultant job, and tier 2, you just get a specialist job. Tier 2, you get a specialist job. Tier 3, you just get a registrar job in UAE or in any of the GCC countries. So it makes a lot of the pay is huge. There's a huge difference in the pay. There's a huge difference in the pay. With UK experience, CSER, you get, I think you can get a minimum of 15 to 17 lakhs per month. Someone with 2 year post MD experience, what would you suggest? 2 years post MDA experience, if you're able to, if it depends, if you're able to provide all your reports and all your statistics from wherever you have your experience, if it's in a good corporate hospital that has all the statistics, then you're able to demonstrate you are very involved in MDTs, then you can directly get into a fellowship or directly as a locum consultant. But if you think that you won't be able to prove any of the fellow evidences, then you can still start as a locum consultant, work for 5 years, collect all your evidences for 5 years as a locum consultant here in the UK, and then apply for a CSER, because you just need 5 years of evidences. And if your trust is ready, if your hospital is ready to extend your contract till 5 years, you can extend till 5 years and then submit your evidences for 5 years, collect everything in the UK, and then submit. Or if you think that no, this is a lot of pain, I would directly go to a CCT pathway, then definitely you can. Yeah, yeah. Most countries want CCT. Yeah, most countries are happy with they are happy with CCT, or yeah, CSER. They do accept CSER with 3 or 4 years of experience, but yeah, CCT is preferred over CSER. Yes, for UAE CCT, which is valued. No, I think yeah, you do have CSER that is being valued. I'm sure that CSER is also valued. CSER with 5 years of experience is still you still get a consultant job. I'm very sure of it. I know people who have done that. Yeah, that's why. So yeah, you will be considered tier one. You can have CCT or CSER with 5 years of UK experience. I have done fellowship in fetal medicine in India, but antenatal scans are not. Yes, you don't do antenatal scans. Only fetal MRs are reported by pediatric radiologists. You don't do antenatal scans. Antenatal scans are done by the fetal medicine thing. Yeah, unfortunately. And that's why even in FRCR, you don't have any of the antenatal questions that are being asked. How do you get subspecialty fellowship in CCT pathway? So you finish ST3, ST4, ST5. So you do 2 years of 1 year of general radiology, 2 years of some subspecialty, and then you can do an ST6 you can do an ST6 in whichever specialty you want. So you can do a subspecialty fellowship even after CCT. Say, for example, one of my co-fellows did finish his CCT in March this year, and he's doing fellowship in pediatric radiology with me. It's an ST6. Yeah, I'm sure that UAE takes CSER as well. CSER with 5 years of experience is still considered equivalent to CCT. That's why it's called CSER, Certificate of Eligibility of Specialty Registration, Specialist Registration. I'm very sure of that. Yeah. Okay. I hope it was useful, and I hope this was. I hope you guys got to know something, and it was quite useful. You can reach out to me on LinkedIn or anywhere. It says Ebinesh Arulnathan if you need any further questions, if you have any further clarifications you need. But yeah, regarding sorry UAE, let me tell you that I know people who have done this, and I'm sure that CSER is accepted. But other than that, I don't have much idea about the Middle East or the GCC pathways. Yeah, I think it was useful. Thank you so much for joining, and all the very best if you're in the middle of your FRCR preparation. Bye bye. And thanks, Nishan.